Is this thing on? I'm totally kidding. I like to have fun. My name's James. I realize you guys got to see my face yesterday during orientation, but you really don't know who I am or who this stranger is that's going to be teaching your Med-Surg Nursing Theory course or spending every Friday afternoon with you. So I wanted to take a moment to send you a quick video, introduce myself, and talk to you about some important links on Blackboard and some important resources that I hope you already have in your possession, and just outline some key information about the course. So first things first, the course is 273. I have taught it in the past with Linda O'Halloran, which she's a good friend of mine. When I went to school, we called this course Junior Med-Surg, or Introduction to Med-Surg Nursing Practice, and believe it or not, my clinical instructors or theory instructors at that time were Liz Green and Lynn Compton, and they made that course rather challenging, and I was grateful that they did. Because again, they prepared me for the Canadian Comprehensives, and yeah, so we're going to be throwing a little bit at you. You probably heard that this course is rather intense, and it is. That being said, I consider myself not only a nurse, but also somewhat of a personal trainer. And you're paying good money to go to school, right? You definitely don't want someone that's going to say, it's okay if you sit back and don't do 20 push-ups, or it's okay if you sit back and don't read 20 pages. Not really, when you've got the Canadian Comprehensives coming around the bend. And you've got to prepare for going into Judy Bornier's and Debbie Rickard's sim in third year. So colleagues of mine at the university, and I've taught at the university before as a sessional instructor, and I think you're really going to enjoy the experience, and this course is going to prepare you a lot for what to expect in the upcoming years. Again, this is your Junior Med-Surg. We're not going to cover this textbook cover to cover this term, but we will be reading selected chapters that are outlined on Blackboard. Okay, so if you don't already have this, please acquire it quickly. It is your Med-Surg Nursing textbook by Lewis. It's the 3rd edition. It's the Canadian version. If you have an older version, that's perfectly fine, but please make sure that whatever you've got the Canadian edition. It's extremely important that you don't want to do any conversions in your head, and that the information, evidence that we're giving you is relevant to Canada. The other textbook that you probably already have, and forgive the nails on the floor, those are my dogs, is your Cozier and Herb Med-Surg, or Fundamentals of Nursing textbook, and that is the 2nd edition, Canadian version as well. You probably already have that. It was a required textbook in 1st year. And the last thing that you'll need for this course to be successful is a laboratory and diagnostic manual. Doesn't matter what publisher you get or what version you get. If you have one already, excellent. But I would recommend that whichever one you do acquire, that it's a Canadian reference. That when you look at the conversions, they're all Canadian, okay? What else can I tell you about this course? I'm hoping that it's going to be interactive and fun for you, and that I'm not afraid of technology, as you can tell by this method. So I'm going to be doing some web tutorials or some talking PowerPoints, maybe some discussions where I throw a question up on the board and you're going to use your smartphone to give me a response. Again, that's anonymous. I'm going to try to be interactive. If you could, when you log into Blackboard for the first time, there is a welcome with 2 links. Both of those are surveys. The first one takes about 16 questions, really quick, and it tells you what kind of learner you are or what kind of style you are. I'd really like to know that prior to these upcoming weeks. And the second one is a little bit of demographic information that I'd like to collect to get a whole entire picture of the course, okay, of the class. What can I tell you about the stranger that's standing in front of you? Well, I absolutely love what I do. I have been blessed. I think this is the best job in the world. I think you guys are so lucky to be embarking on your career. And a lot of what we're going to talk about, you're going to use hopefully for the rest of your career, depending on where you go and work. I've been nursing for about 15 years. I started that out in Windsor in an active, busy ortho unit. I went over to the States. And I worked in their surgical intensive care unit, a level 1 trauma hospital, Henry Ford Hospital. I've worked at a few hospitals over there with agency nursing work. I've worked in busy emergency departments, active surgical units, med-surg units. Most recently in Canada, both at Windsor Regional Hospital in the critical care, and also Hotel Dieu Hospital in the cardiac program. In the cath lab as well. So I'm hoping to bring some of my experience to the classroom, okay? And recently I graduated with my master's in nursing, so as of recent of this June. I was rather excited about that, so I know that you guys are halfway through your journey or about to become halfway through your journey. And I know it's a long journey, it's a tough journey, but it is well worth it. You have the distinct pleasure of taking care of people right from birth through to their passing and taking care of their families with them, okay? You're going to love this job. It's not really a job, it's a profession. What else can I tell you? I started out in the RPN program, moved into the RN program, worked for a little bit in a busy ortho unit, and then went back to school to pursue my bachelor's with honors. And after that, I went back and started to pursue my master's with a little bit of nudging from my colleagues. That being said, I don't think you can go wrong with education. Every single step of this journey has been a lot of fun and taught me something. And usually it's when you look back, you realize the benefit of what we've been giving you all along. Without material. If you struggle with any aspect of this course at any point in time, please know that I'm extremely approachable. I will not think that you're not smart if you ask a question that you think is silly, because I certainly don't think it's silly. And I hope that when we ask questions in the classroom, we create an environment that's safe. Because if someone doesn't know something, chances are 3 to 5 other people don't know it either. And as you can tell, I talk fast. Maybe you might need to ask me to rewind a concept and review or revisit a concept. I'm more than happy to do that. Again, this is your education. I want to help you. So without any further ado, I'm going to dive onto Blackboard and get off this little video camera here. And I'm looking. Okay, so first things first, when you look at Blackboard, you should see my contact information. I'm hoping that you can see this. Professor James Mears. You can call me Professor Mears or Professor James, whichever you'd prefer. My email, however, is dmears for Donald. I am on Twitter if you'd like to follow me or see what I'm posting. It's at nursing_prof. My phone number, my extension at the college is 3903. My office hours are 9 until 11 every Friday. Now, those have to be emailed or scheduled, so feel free to send me an email Wednesday or Tuesday and let me know that you need some time on Friday, and I will be more than happy to make myself available. You don't have to come by your lonesome. You can bring a friend, so by all means. All right, I want you to click on the Information tab, so we're going to do that now. And right now you should be seeing under the Information tab the course outline. So you can just click on that. That is a PDF. I'll open it up. And you can scroll through this at your leisure. I will be providing you with a printed copy tomorrow during class, our very first day, and we're going to go through some of it. Again, you can scroll through it. My information's here. Linda O'Halloran's information is here. I just want to scroll down to how the marks are divvied up. A lot of this information we're going to cover the very first day of class, but there's this right here, this course requirements, section 6. You're going to notice that there's in-class learning activities, and so 5 times out of the semester I'm going to have a random in-class learning activity. You need to be present for it, and if you're there and completing the task, then it's an automatic 1%. Then we're going to have 2 tests, one the week of October 7th and one the week of November the 4th, and then finally we're going to have a final exam December the 6th. That's at 3:30 in the afternoon, December the 6th. The room will be to be announced. And that's worth 40% of your grade. It is cumulative. And although we will cover a lot of information during this course, I don't think you have anything to worry about. The reviews and the mock tests for these tests will definitely help you significantly prepare. Okay, I'm going to back out and I'm going to go into the Content tab. So if you click on Content, the very first folder that you'll see and also included in this welcome announcement was a link to a learning style quiz. So if you click on that quiz, I'm just going to click on it now, you should see 16 questions, and you'll just quickly select responses to each one of those questions, and at the bottom you'll hit submit, and then that will tell you what kind of learner you are. And from there, I'd like you to go to step 2, click on that survey. Let's click on it. And that survey will take you to a link that tells you, welcome to the course. You can scroll through it. Oops, sorry. Let me scroll through it for you. And you can put what kind of learner you are, visual, auditory, kinesthetic. Maybe you were surprised by the results. Whether or not you work outside of class. What's your anxiety level for the course? Is English your first language? Do you use Twitter? Stuff like this. Random questions. I'd like to know a little bit more about you. If you were struggling in the course, what would you do? Some other information. Are you an extrovert, an introvert? Are you a perfectionist, a procrastinator? Do you read prior to coming to class? So you can see why I'd want to know some of this information in order to be prepared and build activities that will be suited for your learning style. And recognizing that there's more than one learning style, we're going to try to hit all three. Okay, scrolling through, some of these tabs will not have any active content in them. I'm going to click on week 1. And you're going to notice it's just got introductions to the course, the outline, and then a few chapters that we'd like you to be reading and skimming prior to coming to class, and which is why I'm sending this out now. And also this best practice guideline, these strategies for self-management of chronic conditions and also for pain. Keep in mind they're rather large, so if you're downloading or if you're printing, be mindful. You don't need to print these, you can just refer to them online. I'm going to back out to the content section again. I would like to scroll down and take you to the very first mock midterm. So what I've done is I've designed mock midterms that are very similar to the actual midterms that you'll write. So there's one there, and a final one. These, what you can do, you can log in and do as many times as you'd like. They'll give you an idea as to whether or not you're understanding the learning objectives, and will help you maybe tailor your studying habits prior to coming in and writing the midterm that actually counts for marks. So please be in mind, this did take a lot of effort on my part to construct, but previous students said that it was invaluable. Again, feel free to test drive it and see if you like it. I wouldn't encourage you to do that until after you've read a bulk of the material, so you really get a sense of how well you're retaining the information and not memorizing it. All right, any other links that I want to show you here? Not really. So we'll talk about a lot of that in class. I do want to show you to the discussion board feature, so let's click on discussions. You're going to notice that if you have any problems with the material, that you can post something, and you can post it anonymously so no one knows if you didn't know something. I've also included last year's posts, so you're going to see how students, what they asked and how they helped one another. And that's the key, that we help one another. This is an online community, but I do want to point down here that, again, everything in a technical world, it doesn't take very long. If we wanted to figure out who posted something, we very well could. I don't try to do this. I don't care if you know something or don't know something. To me, the learning environment should be a safe one, and I feel that it's more practical that you ask a question and feel safe about asking that question, and that you help one another, because that's what nurses do. But very important that you pay attention to my preface here, that if Blackboard is used unprofessionally or inappropriately in any way, you're going to be held accountable to the student code of conduct, and also what would be the professional standards of nursing. So you'll be held accountable to both of those as rulers or benchmarks to how you should communicate. But we'll talk more about the very first day. If you find any cool links that you think are really helpful, maybe you found something on Khan Academy or quizzes or YouTube, feel free to post them under here. And then if anybody wants to form a study group, there's another link down here. So that's the discussion board. Feel free to go on there, and just be mindful that previous students' comments are there. So hopefully that'll decrease your anxiety and whatnot. And I'm going to back out to content again. So just a quick blurb, if you could do the learning style and also the survey that will tell me a little bit about who you are. Keeping in mind, both these surveys are completely anonymous. Again, it's not important for me to know who responds how, but as what the class looks like as a whole, collectively, so I can design and structure activities that kind of meet everyone's learning needs. Don't let the textbook intimidate you. I realize that if you do look at it early, it can be overwhelming. We're going to take it in manageable bites. I think you're really going to enjoy this course, and a lot of it is going to be very relevant to your 272 course, your labs, and also your clinical. This is probably one of the most exciting courses that I think you've taken thus far. I'm a little bit biased. I really do love this course, and I'm looking forward to seeing you all Friday. Take care.